shouldn't say that. Hello, everyone. Welcome. We're sorry for the delay. We had a few technical difficulties. We are technically challenged, but I would like to welcome everyone to our Facebook Live discussion for the Haitian American Nurses Association. My name is Pauline Lewis Magis. I am the president of the Haitian American Nurses Association of Florida. And today we are here to have a very candid discussion on the effects of COVID-19 mental health impact. Along also with me, we have Ms. Emanuela Jean-Baptiste, who is a registered nurse emergency room specialist. We have Dr. Marlene Cesar, who is a mental health specialist, nurse practitioner. And we have Marjorie Lozama, who is also a nurse practitioner, mental health specialist. As we all are aware, COVID-19, which is a form of coronavirus, was first reported in Wuhan, China in December of 2019. And because of the rapid spread of the disease, the World Health Organization made it a global pandemic. As of today, there are 2.7 million people worldwide that's infected with the disease, and over 800,000 deaths from the disease. Currently in the United States, we have more than 900,000 people infected with the disease and more than 50,000 deaths. And in the state of Florida, our beloved state of Florida, there's more than 30,000 people affected with the disease and 1,055 deaths. Because of the large amount of people that have been impacted by the disease, there are some form of mental experiences that people are having. We all know how the virus is transmitted to person. It's an airborne. If you're in close proximity with someone that is affected by the virus, you can catch the virus. If somebody that has the virus sneezes or coughs and the molecules of their sneeze or cough fall onto a surface, you touch that surface, and by touching the surface, it now becomes on your hand. And if you touch your mouth, your nose, and your eyes, it can be transferred to your body in those modes of transmission. The virus has caused a lot of devastation, hence by the number of deaths. And with social distancing and stay-at-home orders that have been, people have to stay at home, that has caused a lot of depression has risen. The stress that we go through because of this virus, not just us healthcare workers, but everyone in general, no matter what level of work. We know that many businesses had to close because of the stay-at-home order, and because of the businesses that had to close, many people are out of a job. And because they are out of a job, that can be some form of cause a mental effect on these people. So today, we're gonna discuss how it is impacting people. We're going to talk about signs and symptoms of stress and also to depression, because if somebody was suffering from mild depression before this happened, and because of what they have to go through now, that can increase their depression, also to the anxiety level. Miss Emma Jean Jean-Baptiste is a emergency room nurse who is at the forefront or front line, as they call it. But we know there's other people that are also frontline, not just us healthcare workers, but you see it on the news, grocery store people who are working in the grocery store who are also being impacted by this. But Miss Jean-Baptiste is going to, first of all, Emma, thank you for joining us. Sorry about the technical difficulties, but we're up and we're running. So Emma, I'm gonna start with you first. If you will please just give people a little bit about your background and we can move on from there.
Hi everyone on Facebook, Zoom Live. My name is Emmanuela Jean-Baptiste. I've been a nurse for many years. And just before our virtual meeting here on Zoom, I just learned the passing of a very good friend that happened last night.
Oh, I'm sorry to hear
this gives me a different perspective of the virus, because we have many members of this organization that are nurses that I have lost brothers and sisters and best friends. And as a nurse who go to work every day to care for patients, I can tell you the first March 6th, I learned I was in contact with someone that was tested positive for the COVID-19. I can tell you for 14 days, I was not able to sleep. The reason that I was not able to sleep, this person showed up as a flu symptom that ended up being COVID-19 because he had traveled to New York. Since I got that news that day, I have been taking very, I went to a different step. Now I take precautions to any patient that I've seen in a hospital anywhere or anybody on the street. So I take precaution, even though I'm talking to someone, taking care of them. But it is very hard. When you go to work, you have to dress up to go inside a room to take care of patients. You have to provide the care. You have all this garment around you. You have so many masks, and you have your faces covered, and you have to provide care to a total patient. And you know, Pauline, exactly what I'm talking about. Sometimes it's not even easy when you don't have any. You just have a scrub on, and I have to tell you, you have all this on. You're very hot. You're in a room, and you're providing care to someone that is very sick, and that is also scared. And this make it hard because this person cannot be with a family. And according to, you cannot, all you can do is providing care, make them feel at ease, make them feel they're gonna feel better by tomorrow. Whatever you do is to make them feel better. But in your heart, you know from the things they have seen on TV, you cannot guarantee anything. So he has been hard because I worked with people who has been positive for COVID-19. As nurses, we know there are so many nurses that have died from this COVID-19 virus. Mm-hmm. So you don't know in your mind, in your head, what mistake those nurses have made and the care of that patient. And in the back of your mind, you're always thinking, what mistake I'm gonna make to catch that virus myself. So you always go the extra mile so you don't get infected. You don't, it is hard. It is hard waking up every day because you're going to work, you're gonna provide care, that's your job, that's what you have to do, that's what you like to do, you love to do. But you also have to come home. You come home to your kids, you come home for us, for those of us who have mothers that live with us, like myself, which is 85 years old, who have a lot of medical conditions like diabetes and heart problem. You worried about carrying this disease to your home. So actually, as a nurse, when I go home, I don't go inside my house. Probably 1 hour after I sit outside, wash myself with all the alcohol I can find before I go take a shower. Sometimes I spend 2 or 3 days not even say good morning to my mom because I'm afraid if I get something, if I get too close, I might transfer it to her. And I also have a daughter who like to jump on me when I after work. Now I have to prevent everybody from even giving me a hug. And this is the hardest part.
So for you, Emma, listening to you, and I know what I experienced my very first day when I went, and took care of patient. You're in the emergency room. So with you, when the patients come into the emergency room, you don't always know if that patient is a positive or a negative patient. So I know I can understand the anxiety. And speaking from a critical care nurse that I am, taking care of these patients, and I'm sure many of our members who are also working, whether it's a member here in Florida, and we know that up north in New York and in New Jersey, they're impacted even more. Now, in the whole of the United States, New York is considered the epicenter. They have the highest cases, and New Jersey is #2. And we're in Florida, we're #8 on the list as far as the highest number of cases. The fear of possibly catching the disease and then bringing it back to your family. I hear that, and the fear of you taking care, you want to be, because many people say this is what you're supposed to do. Yes, we understand that. And you want to provide that care with lots of compassion and lots of passion, which is what we do. But then in the back of your head, you have that fear that what if I get this virus and I could be that patient?
Remember, you're dealing with patients that's seen in the news, what's going on around the world. Mm-hmm. They come very sick, also very anxious because they don't know what's going to happen to them. They just know they may not be positive for them. But I can tell you, if someone is positive, wherever you tested, they will send you to the hospital if you have symptoms. And some people do come with mild symptoms. They come, they have a chest X-ray, they clear, they go, but they still go home with that anxiety because they have to be confined for 14, 15 days.
14 days,
they cannot be with their family. Some of them ask you, can I please stay in the hospital? The hospital cannot keep you if you are a stable patient. And discharging someone like this, knowing they're going back home to the community, to the kids, not able to do what they used to do for their own kids, and they have small kids, and they're talking to you as a mother, this makes you feel bad when you know you have to send somebody who doesn't have any help. As a matter of fact, the last couple of weeks, I had a patient who has no backup. And I have one special patient, a young lady with 2 kids. She had to come to the hospital with those 2 kids. And she's gonna be tested, the kids have to be tested. When you look at it, they have to find a way to keep them together. Otherwise, those kids gonna be, they're gonna call this year. So this is hard for the hospital to deal with. This is hard for the family to deal with. And our parts, we're dealing with nurses that also have small kids. They have to come to work taking care of those patients. When they go home, they cannot go back to their own life. Just the basic thing to say hi to hold your baby. That's very hard.
Because that's a major issue with dealing with this, because you have the nurses that are at every single hospital in the United States. You have nurses that are taking care of COVID floor. There's patients in every single hospital in the United States that is admitted because of the disease. And so you have nurses that are being isolated from their family. I know, the day I worked, when I came home, after I took off my uniform in the garage, I went straight to the room and went straight into my shower, took my shower, and I did not speak to my kids or anybody because of that. And I took my shower and went straight to my bed. And I meditate in a sense of what just happened, being a nurse for so long. So this is going to take us to Dr. Cesar, who's going to, and thank you, Emma, for sharing your story. Dr. Cesar is going to talk to us about stress, which is what we all experience. We're all going through it, whether you've been impacted as a healthcare worker or a family. I think everybody knows somebody that has a debt. And it's like, unfortunately, every single day you're hearing someone telling you somebody died from COVID. So stress level is increased. Anxiety level, especially for our nurses, is up. And of course, depression. And some people have a hard time, Dr. Cesar, of distinguishing when, okay, I'm just stressed or I'm feeling depressed. Because some people can be going through depression and thinking that, okay, this is just happening to me because of what's happening. Dr. Cesar, if you can please just help our audience and our members who are watching the Facebook Live understand the difference between the stress, anxiety, and depression and how dangerous it can be. And then we'll have, of course, March tell us some of the wonderful things we can do at this point. Hold on, Dr. Cesar. Dr. Cesar, okay.
Good evening.
Dr. Cesar, can you start over? Because we missed the first thing you said. Sorry.
Yes. Good evening, all my friends on Facebook, all nurses, and especially the healthcare professionals that are at the front lines. Thank you, Emma, for giving us such a beautiful way of feeling yourself when you're working on the floor as a COVID caregiver. It is always difficult in moments like this, which is very uncertain for us. The COVID-19 has put a very, 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 very strong toll on everyone, whether you are a nurse, whether you are a mother, a father, or whether you work as a teacher, wherever you work and you have been affected by COVID. It is a good question when you say, what is the difference between being anxious and being stressful? The National Institute of Health, which is NIH, they define stress as an emotional and a physical reaction that you have to a change in your life. But COVID-19, it's a change. It's a change in a sense, it is a challenge. It is a challenge for nurses to be able to face their fear and also provide care to the patient the way they should. And while they are giving care to patient, they have to worry about their own self. Normally, in normal time, we said that stress, it's a good mechanism. It's a positive mechanism. But to things that are beautiful, I'm going to take a test and I get very anxious because I'm taking a test. Soon I take the test, I pass, I'm okay. Most of the time we get anxious if we look at it and chemical involvement of stress. It's a way to fight or fly. Okay, so it is normal to have stress so you can get out of it immediately. But the stress from COVID, it's an everyday thing. The stress from COVID, it's an every hour thing. The stress from COVID, it's not only for workers, but it's only for people that are confined at home. We are confined at home. We don't have to go to work. But however, we are stressed. We stress with the news. We stress with everybody talking. As soon as somebody say COVID, your heart starts pounding. And it's also a stress for people who lost a member of their family, or for people who have members of their family in the hospital, or people that have grandmothers, grandfathers in a nursing home. You cannot go see, you have to go to the mirror. Of course, this situation put us in a very different stress, which is not the normal stress that we are saying it's a normal mechanism. This stress is so heavy, it takes a whole toll on your mental health that you may crack, that you may fall. And if you fall, that's where you fall to an anxiety. And your anxiety, it's also another state, emotional and physical state that makes you going with your heart pounding all the time. As soon as you put your feet down, you feel like you're going to fall, you're tumbling. How are you going to give care if you cannot even stand on your own feet. It is so hard, the anxiety that nurses are feeling on the floor at the hospital, doctors are feeling, because that anxiety, it's not only fight and fly, it's real. It's a real anxiety. You have a patient to take care. You powerless. You don't know what you're going to do. You don't know the outcome. Normally, as a nurse, we want to know the outcome. We want to know what's going to happen. We know that if we do this, we do that, we're going to have this outcome. But right now, you don't have a plan. You cannot even modify anything because you have no plan. So you become more anxious. Not only you anxious for your patient, but you're anxious for your family members. You don't want to go home. What about if I have somebody sick at home? What about if I get everybody sick at home? So that's another type of anxiety. You go from your place of work with anxiety and you go home with that same anxiety. So at that time, one thing that we have to be careful is that anxiety can become a general anxiety disorder. And if it does, too bad. That's the time we're going to have a clinical anxiety problem. It's not a mechanism anymore. It's not a coping mechanism anymore. It's going to be a very negative coping mechanism because it is becoming an anxiety disorder. As far as anxiety disorder, now you go from a little stress to a higher level of stress, that is anxiety. And from that anxiety now, if you are becoming non-functional at work because you are so anxious, you get into a depression. So those are the steps that our nurses are going through. And everybody is trying not to get to depression. Because if you get to depression, that's another thing. Because DSM-5, which is our Bible in psychiatry, is giving you depression as a constellation of symptoms. You have a constellation of symptoms that you have to look at if you become depressed. Because first of all, when you become depressed, you still have to handle your anxiety, because anxiety is one of the symptoms that you may find when you are going through a depression. Then you sometimes that depression, that anxiety in your depression state can become so bad, it becomes to a panic disorder. You become so panicky, your heart palpitate, you have accelerated heart rate, you sweating, you trembling, you shaking, you don't know what to do, you have shortness of breath. Now everybody is going to tell you, seems like you have COVID because you cannot breathe anymore. If you don't cough, but you have one symptoms of the COVID. Then you may think also that you have something, the feeling of impending doom. You feel like you are out of control, you're powerless, you don't know what to do. At that time, you really need to stop, because you won't be able to go further, because you are getting yourself into a depression. And when you get to the depression, guess what? You have to deal with your anxiety, but you have to deal with something they call anhedonia. And that anhedonia, it's a word that you are not interested in things that you used to be interested in anymore. You are not taking care of your people at home. You don't care about anybody anymore. You just you go home, you get in bed, and you don't want to wake up. You fatigue, you don't want to work, you don't want to go to work, you don't want to listen to the news, you don't want to do anything. And that's where you get yourself into a deep depression. And when you get to the deep depression, guess what? We have to do something. And normally in psychiatry, we have to go coupled, do psychotherapy or give you medication or do both. You don't want to get there. So that's the reason why we are telling people to be careful not to get from their little stress to a larger anxiety feeling and then to depression, because we don't want them to get.
Okay, so Dr. Cesar, thank you so much for that explanation. From what I'm hearing, because we do have little stressors, and those little stressors can become big stressors. I'm going to bring in Marge. Marge, if you will, just kind of elaborate a little bit on what Dr. Cesar said, as far as when do you go from what would be considered normal stressors versus the stress where you start to worry. And I know you can speak from maybe share your little bit of experience of COVID-19 as well, and what did you do to help you? What you do that helps you cope, basically?
Well, good evening, everyone. I hope everybody can hear me, and good evening, Facebook friends and family and all HANA members listening and everybody out there that are following us. It is, again, a pleasure to be here with you guys tonight. And so I think Dr. Cesar elaborate really well on the fact that we have little stressors in our lives every day that we're able to manage. And those are positive stressors that keep us moving forward. Let's say I'm going to take a test and I have stress and I know I have to study to do well. So those are positive stressors that we can experience in our daily life. But with the COVID-19, it's a major, like Dr. Cesar stated, it's an everyday stress. That if it's not well managed, it may turn into a clinical diagnosis of generalized anxiety or depression. So for me, and I want to thank Facebook family and my HANA family and everybody out there that really reach out and send me prayers and word of encouragement every day, because I lost my brother to COVID-19 about 3 weeks ago, April 1st. I was hoping it could have been April Fool, but it wasn't. It's hard, and I'm not going to sugarcoat it and say that it was hard. It's hard. I'm still going through it. I was already dealing with the stress of the COVID-19 because we are human beings. We like to be in control of our daily lives. And once we lose that control, then you're stressful over things that you cannot control, because we like to go into our routine, and then most of us has lost our routine, so that caused stress. And for me, having lost my oldest brother to COVID-19 added to my stress majorly. And I don't know, I see Emma bigger than I see myself, but anyway, so it really added to my stress. And what I've done to cope, there's different coping mechanisms out there for everybody. And then you really have to choose what works well for you, because I can tell you to do certain things, but it's not going to work for you. It may work for me, but it may not work for you. It may work for your friend, but it may not work for you. But at first, I'm going to address the nurses out there. The nurses, I'm just telling you that you have to put your oxygen mask on. Like on an airplane, they tell you, put your oxygen mask on first in order for you to be able to help somebody else. So if you don't keep yourself taken care of, and then you can succumb to everything that Dr. Cesar just described, such as taking a good sleeping. I know it may be difficult with stress. One of the things that when you're under stress, that can go, it's either you eat a lot, you go to comfort food, or you lose your appetite. And another thing that goes also, it's just you cannot sleep well at night. And then that was me. I wasn't able to sleep when that happened. So I know nurses, when you come home, you're very stressful, but you have to find ways to relax, to decompress about what happened in the hospital. I was talking to a nurse in the hospital, and then she said that they have support group among the nurses, finding somebody that you can share your experience, especially nurses that work with you that are experiencing the same thing. If you guys can group together and really vent and share, and then people can share what has worked for them and maybe able to work for you. Like you listen to Emma, like what Emma described earlier, a very stressful situation that she goes in every single day. And then she share what works well for her. But within nurses, you can have support group and maybe seek a professional in behavior health to join that group and better guide you guys and help you better cope. But that would be one thing, sharing, having somebody that you can trust, that you can share your experience with, having a good night's sleep, eating a healthy diet is very important. And there's deep breathing. We said meditation. We have a lot of apps out there that make themselves, that provide the services free for medical providers, such as we have Headspace and Calm.
Okay.
And it is two meditation app that are free for medical providers. And then if you're not a medical provider, it's also free for like 1 or 2 months. You can try it out, for free, and then it gives you that time to develop some meditation habit. And I think it takes, the researcher said it takes, 21 to 61 to 66 days to develop a habit. So it has to be constant. That's something that you keep on doing. It's like going to the gym and exercising. The first day you go, it's going to hurt. You're going to be uncomfortable. But as you keep doing it, you're going to feel better. So if you want to try meditation, you may not get it the first day. Don't give up. Continue on doing it until you get comfortable with it, if that's something you want to do. Exercise release serotonin, dopamine to the brain. It's the best medication they say out there. It's for mental health. So if you can take 20 minutes, 30 minutes walk, or there's a lot of app out there on your TV, YouTube, that you can tune in and do some type of exercise, and also to release that stress. I know what worked well for me, which drive my family very crazy, but it works for me. I clean a lot, but that's my stress reliever. I clean, but that's what works for me. And I have other friends as well. When they tell you, Marjorie, I keep on cleaning, I said, I get you. I understand you, because that's what I do myself to help me out. And
so basically, sorry, Mar. So basically, someone should find, because you just mentioned that you clean when you're stressed, you clean. So find something that that calms you down, something you can do that calms you down, because maybe that person might not be into the meditation, not be a reader, someone who's going to read a book, but something that can take you out of that stress. Don't forget your thought. So Emma, what have you done, you think, that have helped you to kind of cope? Because you work just about every day, and when you come from work, you explained everything that the fear. What one thing you have done you think that has helped you?
Praying. I just talk to God.
So spiritual.
I just sit
If you're
down
a spiritual person,
and just,
okay.
you don't have anybody to talk to. And the people that you can talk to, they are all nurses
So you can talk to anybody. I'm here.
Yes, they're all nurses who
Marge
go through the same
available.
thing you
Marge
go
is
through.
available.
So I would sit down, listen to French music, which I was raised with, and I
Okay,
like
music.
French music.
Okay.
And then I will meditate and talk to God and say, God, please protect me, because I have done everything that I was supposed to do today. If I made a mistake that I did not pay attention, I just go to a different, I don't know if you call this meditation, but I do go speak to God the morning.
So spiritual, if you're a spiritual person, you can use your spirituality as a way to calm you down, to help relieve.
What I wanted to ask Dr. Cesar, we go to work.
Some people like to dance, some like to dance. Yeah.
I love to dance, but I don't dance. I'm so scared. I'm always in pain. And after work, you just very tired. Oh, one of the things, you wear a mask.
You are asking me a question.
Mm-hmm. Oops.
N95 mask the whole day. You getting and getting out of the room. You probably does not breathe 50% of the oxygen you used to consume, because everything that is going on. By the end of the day, you're really tired. You're really tired mentally. You're really tired physically. And by the time you drive home, you just don't have any more strength to do anything. And the only person you can rely on is talk to your God, which is what I've worked for me. But what I wanted to ask Dr. Cesar, you go to work feeling very, very anxious. You go to a patient's room, you know deep inside from the news, from everything they have known, there is no guarantee for them, it's either they get better or they get worse. You cannot guarantee anything. How do you deal with this anxiety? You know this patient is anxious. You know they're scared. Deep inside, even though you want to do your best, you're also scared. How do you dealing with this patient? You're providing the care.
That's the reason why. That's the reason why before I said, I think earlier I was talking to Marjorie and I told her this mental health corner that we are getting to now with COVID-19 really needs a different approach. And the approach is going to be a holistic approach in the sense that we are going to ask everyone to really do a soul searching. Find out where is your internal space. Where is your inner space? Your inner space is where nobody can get. You're the only one who can get there. And when you get to your inner space, that's the time you have to have a higher caller. And you're doing pretty good when you go home. You have no more strength. You have nothing you can do. You pray. And I would advise that you do the same when you are in front of the patient. You don't have to do it. You don't have to talk for the patient to hear. But in your inner space, you ask God to help you. You ask God to give me the words to say to that patient. I am anxious. The patient is anxious. You are the only one who can bring me via the Holy Spirit that peace. And if you believe in it, if you do it with all your heart and you believe that God is in control, God is going to be in control and put the good words in your mouth.
And I can tell you that's the only way you go inside that room knowing that God is in control of everything.
Yeah.
There is no way you can do this for 12 hours.
There's nothing written in books now. Maybe post COVID-19, Marjorie and I, we might sit down and start writing.
Yeah.
How to deal
with that. Yes.
With anxiety,
yeah.
something like that. But right now, we can send you to every single website to look for what is the best way to deal with my anxiety. And I found that word myself, inner space. Find out where is your inner space. And your inner space is really where nobody can get in. No events can get in. It's only you. And that's where you have to rely on your higher caller. Is it God? Is it Jehovah? Is it Allah? Whatever it is, whatever it's your higher caller there, that's where you get the conversation to give you the control that you need. For some of us who are Christian, we're going to call Christ, Jesus Christ, my God, l'Eternel, help me out. But for some other people who are not spiritual in that sense, find out what really calm you down, because there is no word in the book. Marjorie can give you all the coping mechanism. It might not work. So that's the reason the holistic approach.
You said also if it's not spiritual, like if you don't go to prayer, you can find a mantra that you repeat to yourself, when you feel very anxious and then you feel like the anxiety is rising and then you may lose control. You have to find something. Let's say somebody is not into prayer, somebody is not very spiritual, but they can find something they tell themselves. And I know that a lot of people tell me, I said, this too shall pass, or I am strong, I can handle this. Something that you keep repeating yourself, because we know the mind is hardwired for negativity. And then if you do not control it, and then replace it with something that is positive, and then you can kind of lose control of it. So you really have to find a mantra to repeat to yourself that can really calm you down. So if somebody's into meditation, they can do the deep breathing. And I know that I'm not talking only to nurses, but the nurses, it may be very difficult, like Emma stated, to do it when you have the mask on. But if you go to meditation, if the meditation is your thing, master the deep breathing, because when you send oxygen to your brain, it calms you down. Okay, so those are the things that you have to practice them, that they become second nature to you, because it's not when you're in the moment that you're going to try to apply it, because at that time you're too anxious and you cannot remember. So we're telling people, whatever works for you, practice it, make it a routine. And then we cannot control what's going on in the outside, but we can surely control what goes on inside our home. And then that form of having that control inside of home also can decrease our anxiety, especially for people who have kids at home, that not only they're working from home, they are teachers now, helping their kids with their homework and stuff like that. So get a schedule going where you know that, okay, I get up in the morning, let's say I make my bed, I get dressed like I was going to go to work. I work from home, I go on an appointment, but for many years I work from home. But in the beginning, in order for me to train myself and put myself in the working mode, I get up, I get dressed like I'm going to work, and I start my day like that. It's putting my mindset into working. So if you can develop a routine and a schedule for yourself, for your home, this is the time that you work. This is the time I take a break. I go out there, I breathe fresh air, get some vitamin D, sun. And then the kids, when they're done with the school, you do playtime with them, because the kids are also under stress as well. And then parents, we tend to, you know, sometimes they can feel the stress coming out of us. And then we get one of our other sign of stress, anxiety, you get irritated and annoyed easily. So you don't have the patience that you used to have. So you have to be aware of all those emotions that are going around you. And then to see, okay, this is what I'm going through right now, but I can control it. And then developing those coping mechanisms. We talked about reading is one of them, dancing, listening. What helped me for the past 3 weeks is listening to worship music. And then sometimes I put one AirPod on and I'm just keep on listening it until I feel like I'm falling asleep and I remove it. That has helped me cope with, you know, it's the way I'm grieving, you know, it's not easy. I tell people it's not easy. I'm not gonna sugarcoat it. And like I tell my patient, you gotta go through the pain, you gotta go through the emotion. If somebody's in quarantine, your friends, you need your support system, call them, send them a little word of encouragement, send them a little prayer if they're spiritual, a spiritual person. Use the things that you know of them that's really gonna bring a smile in their face to help them cope, because mentally, I said the mind is hardwired for negativity. It's easy for me to go to the negative instead of focusing on the positive. We can go on our social media right now and then everybody's focusing on the people who are dying, but we're not talking about the people who are recovering, because we tend to go to the negative. So limit the amount of news that you watch, and please.
The media.
Marge, and you made sorry to cut you off, you made a very valid point. The number of people recovering. One of the things that I always tell people, you know, as an educator and also as a preceptor training new nurses, I said one of the I guess you can say the greatest feeling that I experienced is that patient that you came in that was near death, so bad, and at the end of your shift, that patient now is able to breathe and talk. So, and currently, as of today, this morning at 11 o'clock this morning, there have been worldwide, there have been 823,742 people that have recovered from the 2.8 million. So that's a good thing. That's something good that we can look forward to as far as COVID-19. Yes, a lot of people died. Unfortunately, the critical people, they do die. But the ones that have the not so severe symptoms, and some who have been critical, because they tell you 67 to 80% critical patient died. So think about that 20% that survived. So that's a positive outlook as far as the number of people that have been impacted. One thing you said also too, as far as taking care of your heart, you said sleep. Mm-hmm. And many of us
cannot sleep.
Cannot sleep.
And I'm one of those people. When I am stressed, when there's a lot going on, no matter what I do, I cannot fall asleep. Right. drink, tea, types of teas that should help me relax at night. And I do fall asleep, but I don't stay asleep. So I'm sure there's a lot of people watching us on Facebook Live that can probably agree. What can somebody do? What can you do that would help you? There are times when, like Emma mentioned, prayer, or probably reading the Bible, or reading something positive. And after, reading it for a little while, then you fall asleep. But then staying asleep is the problem. So what advice can you give from a mental health perspective that will help that person, not just the nurses, but that person who probably lost their job? Walmart worker who leaves after stocking the shelves and working all day, who goes home thinking that am I going to get this? He's up all night and he cannot sleep. That teacher who's worried about her students not getting the right amount. So anyone, what advice can you give to that, to those people?
Well, I think different things work for different people. Like you stated, one of the things is prayer. Like I mentioned myself, for the past 3 weeks, been very difficult. And I listen to worship songs, and it has helped me. But if you really, if somebody is into meditation, they can meditate to decompress. And like you mentioned, some herbal tea, the natural stuff. There's a lot of natural product out there that can help people to relax a little bit. And then try not to exercise, before going to bed. It might hinder your sleep pattern. And then practice sleep hygiene. It's like you cannot go to bed. You have to go to bed at the same time. Try to have a schedule of sleep. Let's say you go to bed and then at the same time every day, and then try to wake up at the same time every day, and then to schedule yourself. And then sometimes if you cannot sleep, they said just get off the bed, start reading. If reading can help you fall asleep, some people, once they start reading, they fall asleep. So if reading can help you, but you get out of bed and then you go and then you sit or read, or other people just start praying. If they just fall asleep and they wake up and they start praying again, and then that helps them fall asleep again. I know it's very difficult because I'm dealing with it, but we have to find what will work with you without, getting you on medication, because we know it's you're going through it every single day. But when it comes to a point where it's really hindering your daily routine, and you cannot sleep, you might want to see a professional
and get some medication.
And get you some medication. But it's trying different things to see how you can relax. Like lavender is very relaxing. You can smell it and practice some deep breathing while you're breathing it. Some people have, this machine like an infuser, and then they have them in your room. You can take a bubble bath to relax you. Everything that can do to relax you and then help you get into bed. But if that doesn't work, you may have to see a professional to really help you out and proper diagnose you. And if it continues on for more than 2-3 weeks, let's say the DSM-5, we evaluate you within the 2 weeks. But if it keeps on going, you see that you cannot get any sleep for, more than 2-3 weeks, you need to see a professional. Dr. Cesar, I don't know if you want to add anything.
Yeah, one thing I wanted to add into what you just said, it is very important to understand that as soon as that insomnia becomes a hindrance in your life, you need to take medication. And right now, telemedicine is very, very, very high. So you can call your primary care, and your primary care might give you something for insomnia. And one thing I wanted to add is some nurses, or maybe some other people that are listening to us right now on Facebook, in the past 3 years, they have been diagnosed with depression.
Mm-hmm.
And those people are the ones that are going to have much more difficulty getting through their depression without medication.
Right.
So I know a lot of people forget, oh, 2 years ago I took Seroquel, or I took such medication and I took Prozac and everything, but I'm okay. I never took it again. But guess what? In this situation, it's going to trigger. It's going to trigger your sign and symptom of depression. So it is good if you see that your head being irritable to the point you can't even stand your husband, you cannot stand your kids at home, and you are suicidal.
Mm-hmm.
If you are, please don't let me ask you, do you have a plan? You
Right.
need to call your doctor immediately. You need to go back on your medication. So be careful, because some people, because they've been medicated on, they've been on medication for depression, and they're okay, and there is nothing going on right now. But with COVID, everybody who has a history of any diagnosis, whether it is bipolar disorder or major depression or general anxiety disorder or panic disorder, they need to go back on their medication. Because Marjorie and I, we can sit here and tell you every single alternative therapy to do for you to get back to your sleep or get back to your accepting your everyday life or going through your stress better. You need to go back on your medication.
Right.
And it's very important. I know people tend to forget, but as providers, we know that our patients who've been on medication, they don't want to go back on medication. And when those symptoms present,
The camera has to be what?
so Pauline is out. So it's very, very, very important. Please.
I can hear you. It's just my camera went out on me, but I'm still here and I can hear.
It's very important to think about it and go back to your provider and get some medication. A lot of natural things can be used. You have chamomile, you have mint, you have people talk about warm milk with honey. All of those things can help. But when we go back to the spiritual part of it again, meditation with nice worship music, reading certain song, reading certain chapter in the Bible will also help if you are Christian. If you're not Christian, find a mantra like Marjorie said earlier.
Right.
Okay. So,
Dr. Cesar and Marjorie, I see an increase of patients coming to the ER that just complaining of insomnia.
Mm-hmm.
This is ER insomnia, and I can see that the doctors the atmosphere that we're dealing with, there's a lot of sick people, and someone show up and said, I have insomnia, and 2 or 3 or 4 or 5 people. There is a problem that the community is not addressing, which is part of this. There is a problem. Besides that, people are gonna feel very scared. They're not gonna be able to sleep. This is, for me, a medical condition. Like, I have a headache, I have a stomachache, but I don't think they put too much consideration on those complaints about those patients. That's how I feel. Okay, so there is nothing me as a nurse can do about it. This probably gonna be a mental health issue, and you know, with the how the staff, the cutting of the staff at the hospital because of everything that is going on, and those people rely on going to the emergency room for those kind of care. And I don't think the needs are being met at all, because you were coming for insomnia, the doctor gonna say to follow up with your physician. This physician is not open. They're gonna tell you to call the urgent care. Most of telemed, some people cannot call telemed. They don't have it.
They don't have.
There is the problem.
Experience.
We have already going through a shortage in mental health care. So now it's going to be worse, because we have to start looking ahead post-COVID. Now we have people that are getting into the mental health list as mental health patients because of COVID. So we're going to need a lot of help in mental health.
Yes, Marge?
I suggest that they also, not only the hospital, but there's a lot of clinics. I work in a clinic, and there's a lot of clinics available around that may have grant to help patient and for mental health. So they have to refer those patients to a clinic that can really help them address their mental health issue. I Empower You, and they can call and make an appointment. We have me as a psych nurse practitioner there, and then we have 2 therapists, and and then we address every patient on a need to need basis, like if they have insurance or no insurance and stuff like that. So, and I know there's several clinics out there also that do have the capacity to help patient out there. So instead of tell the patient, yeah, may not have insurance to go to have a primary care physician, but there are different community health clinics out there that can address the mental health issues that they are facing right now. And they
okay, Marjorie, you open another things for me to ask you. You know, our community doesn't believe in mental health.
Right.
And someone cannot sleep or they have some type of depression. It's really hard for them to go anywhere and say, I feel depressed, I need help.
Right.
How this information can be available for those people to know it's okay for you to be depressed with everything that is going on. Right. And this help is there for you. You can call and they don't know.
Right, exactly. And then that's what we're doing right now, Emma. We're on Facebook, and then hopefully and I can find a sponsor to get on the radio, really to educate the community about mental health. I know it's taboo in our culture. We don't believe in it. We think, it's in voodoo, it's something they did wrong. They're being punished by the spirit and stuff like that. So we know our culture has a lot to do with how we receive mental health, but it is an issue, especially, and then we address our depression or anxiety differently than the DSM-5. The symptoms may be different. And we have, and then as a Haitian American, we understand when the patient present with those symptoms, and we able to see this is what they're describing to us because we understand our culture. So our goal is really, as HANA, is to get on the radio and TV, Island TV, like we used to do, and Koze Sante, and really talk about it and educate our community, or especially our Haitian community, about mental health, to let them know that it is a disease, just like mental illness.
Blood pressure.
Mental illness is just like having blood pressure, diabetes. The brain is not functioning the way it's supposed to function. And there is help out there. They don't have to suffer in silence or keep it a secret. I know that in our community, we like to share medication. If somebody has hypertension, well, the conversation should be the same when it comes to mental health as well. If you have a mental illness, you need to address it. And then there's a lot of us Haitian American in the community that are well versed on the culture and can really understand and design a culturally tailored treatment plan to help you and get better. Because if you need medication, fine, we'll put you on medication. But if you need therapy, then we'll refer you to a therapist. If you need both, we'll address both. But to understand that it is an issue, you do not have to suffer in silence, and you don't have to go to life like you're not living, because there is resources available to allow you to have a productive life. And I love my Haitian people to understand that we are out there, and resources are available. There's clinic available. I know the Center of Haitian Study. Yes. There's a mental health component there in Little Haiti. So those are the resources that hopefully we can get on the radio and really share with our Haitian community to let them know that resources are available and they need to tap into those resources.
Mm-hmm.
Okay, can you guys hear me? Can you guys hear me?
Yes.
You, Madam President, but we cannot see you.
Yes, my camera went out, so I'm sorry. I know the public cannot see me. So thank you for all of these insights. I'm sure these advice will be, hopefully, if we help one person, we've helped a lot. Dr. Cesar, I just want you to tell people what they can do other than we gave them coping mechanisms, some things that they can do to help them. But if you can please, if somebody is on the verge, on the deep end, you know, suicide, give some information as to what that person can do, who they can reach out to, and so on and so forth.
Okay. Remember, we said that the end point of any depression that is going overboard is suicidal ideation. So if you do have suicidal thoughts, like you want to die, you don't want to live anymore, you cannot go to this anymore, if you are a member of HANA, we are available to talk to you. If you are a member, if you are a nurse who knows a member, we'll be able to talk to you. However, if you have a plan to kill yourself, your gun is in your drawer, and you want to kill yourself, you need to find out the number to call in the state of Florida for suicidal thoughts. I don't know if it's 311 in Florida.
It's 800-273-8255. They have 800-273-TALK.
Okay. Remember, this number might not be for all the states. I am now in the state of Jersey. I don't even know the number you can call if you are in Jersey, because I just moved to Jersey. However, for our family in Facebook, if you are having suicidal ideation or suicidal thoughts with a plan to kill yourself, you need to find out this number wherever you are, in whatever state you are, so you can call that number and they will help you. They will help you, they will talk to you, and they will provide you with the services that are available in your area. But as far as the members of HANA, if you are thinking you don't have a plan, you're only having suicidal thoughts from time to time, you can call us, Marjorie and I. So
Dr. Cesar, because sometimes I may not be able to respond to you because I am working.
I know. You told me that. That's why I'm not giving you a number.
I don't want to somebody to calling me and not finding me. And also, we have different crisis facilities also. If you feel that way, you can go to one of the crisis facility that is near you. I know Jackson Behavioral Health Crisis. They have one in Miami next to Jackson Hospital. There's one in Opaloka, and then in Broward, they have different crisis center that you can also go to get help. And then that's what I said. It's very important to really stay connected to your family and friends at a time like, because sometimes, you know, a phone call can make a difference. So,
and also, if you have any suicidal ideation, you can go to any emergency room. It doesn't have to be a mental health. They'll care for
Exactly.
you.
So it's basically any idea, if you're having any negative thoughts in your head of harming yourself, if you are, I know we mentioned about the mothers right now that have become teachers, and that's not something you're used to. So, you know, you need to be able to take a deep breath. And family members, reach out to that family members. You know, a lot of people say now they're connecting again to family members, now that everybody's home. So anything that you can do that is going to help relieve that stress, take away any negative thoughts that you might be having. So please, we encourage you to do that. Learn something new. They said, learn a new, you know, like when I was a teenager, I used to sew, but even though I'm working, I really don't have time. In crochet, I did go and I bought some crochet. I bought and I'm trying every night I pick that up. So whatever it is, there's the new crave now, the TikTok videos. People doing, you know, I love to see that because you see people are doing things with their family. Now you have time now to connect with your family because you're home. Yes, some families, unfortunately, Dr. Cesar, I think you mentioned it too, that have issues, but that probably another topic we can talk about in another time. I think we've covered so much today. Emma, I thank you so much for sharing your story. And I think every nurse that is probably your healthcare provider, whether you're a CNA, whether you work in the kitchen in the hospital, whether you're the environmental person that is cleaning the hospital, because all these people are also frontline workers for us. They're healthcare frontline workers, regardless of what they're doing. It's not just nurses and the doctors. And then also to bus drivers or garbage truck men, because they're still picking up your garbage on schedule. The people in the Publix and so on and so forth, the truck drivers that are stocking the supermarket. So we're talking about everybody that is working, that is essential to what we're doing right now. Everyone can feel it, whether you're working or not. Just do something that is going to help you. Connect with your friends, connect with family. In the news source, we know that sometimes, take a break from that, like you ladies said, from the news. The negative aspect, people share on Facebook positive outcomes, and those are the things that we want to be able to do. So we know it's hard, and it's not easy going through this, staying at home and not being able to do the things that you do. We know the people that are sick, not just from COVID disease, but other diseases, risks, those who are also stressed, are nursing home workers, dealing with the nursing home population, the long-term care population, because these are the people too who are at high risk. So we want to also, and we're talking to those people as well, because our nursing home, the nurses, the CNAs, the whatever level you are, from administration all the way down to the janitorial people, they are also impacted by this, and they're probably also still going through their own mental, I wouldn't say disease, but their mental. So we want to encourage each and every one of those people also to listen to some of the advices that we're giving you. And for, our nurses, especially our nurses that are a part of HANA. I know there's a lot of HANA members watching this. Of course, the members in New York, in New Jersey, in Atlanta, in Orlando, Tampa, West Palm Beach. We have a HANA chapter in Illinois, in Maryland. So we're talking to all of them. We're not just talking to our nurses in Florida, but we're talking to all of our HANA. We are here for you, Dr. Cesar. Just send me a text message and I'll give you her number. She's Marge whenever she's available. And she tried to keep us all engaged. She puts positive affirmations for us almost on a daily basis just to keep us all going. And sometimes you just need that one little affirmation, that one little call. And I'm telling people, if you know anyone that's considered an essential worker in your home, it's a frontliner, give them a call. Hey, I'm just calling you, see how you're doing, how's your day going, how you're feeling. Because sometimes you never know, that one phone call, that one quick text message is all that person needed to get away from that negative we're having, to bring them back to So Emma, I'm gonna allow you 30 seconds to say something quick, because Emma is about to die.
With the passing of my friend today, I realized there is something in this community that we're not doing well. The communication is not passing through. I have tested hundreds of people. I can count on one hand how many Haitian American that I have tested myself. And we rely
That's
on,
very
I
important.
know holistic medicine, they know they have the right portion for this medicine. But if you have any early symptom like fever, cough, you have underlying condition, test yourself. And that is probably one of the reasons.
Mais 10 en créole, s'il vous plaît.
Oh,
10
oh,
en créole. Pour moun-
c'est ça en créole. Avec tout ça que moi qui passé dans la communauté, je suspecte qu'il y a une information qui parle dans la communauté. Moi, testé en pile monde depuis Corona, ça a passé. Je compté sur mon main qui valait haïtien que me testé. Nous tous gagnons solution pour maladie. Nous gagnons thé, nous gagnons potion, nous gagnons un bagage que nous avons. Si nous gagnons, et nous connaissons que le pas privé sur nous. Mais avec un amis qui sont passés, je connais des amis ça très très éduqués, qui malade pendant 3 semaines, qui va jamais tester. Je pense que jeudi à la on bagage travail que HANA supposé faire. Travail que nous supposons faire, encourager toutes les amis nous, encourager toutes les familles nous. Si vous avez n'importe symptôme, fièvre, yon grippe, yon corps fait mal, gen pile côté cap tester, moun tester. Si vous testez au positif, vous connaissez comment pour faire prévention pour l'autre famille ou pas malade. Tant pis, passez message ça, bah tout le monde nous connaît. Dire depuis vous pas senti bien à l'hôpital, à le tester. C'est message ça.
Thank you, Emma.
Prends ça à la main pour nous plus faire plus d'éducation dans la communauté, pour nous parler de danger qui gagne le monde pas connaître ça.
Okay, Dr. Cesar, last words.
Yes, I think I'm going to follow Emma on that. It is very difficult for us to get tested. Sometimes where we are, the requirement for testing is symptoms. And if you don't have any symptom, it's kind of difficult to get tested. Like myself, for example, I didn't get tested, but and I'm going to emphasize on symptoms, because asymptomatic patients have not been allowed to be tested where I am in Jersey. You have to have at least 1 or 2 symptoms of the COVID to be so you can get tested. So it's very important. If you can, if in your area in Florida, you can get tested, please do so, whether you're Haitian or you're not Haitian. And all the friends in Facebook, please test, because now the statistic is showing that most of us are already positive, even if we are asymptomatic. So please do so, try to test. As far as your mental health is concerned, equilibrium is the word. You need to be in tune with everything. Be in tune with what's going on inside of you and what's going on outside. Mindfulness about environment. So please take care of yourself. We are in this together, and together we will fight this. This too shall pass. God is in control.
Amen.
Marge, last words.
Right. Yes. And I don't want to repeat Emma or Dr. Cesar. And I would say that testing is very important if you have any symptoms, and then, put yourself in quarantine also to protect everybody else if you cannot get tested. But it's very important to get tested, and we need to, I know there's a lot of organization pushing the message in our Haitian community as well. But it's so if you're home, it's very important that sometimes that we forget, that we say to ourselves, if I had time, I would have done this. If I had time, I would have done that. Make a list of your goals, of the things that you said that you wanted to do. And then this is the time for you to focus. Because if you let your mind wander, it will go to the negative. And you have to pull your mind back and really focus on the positive of the things that you can control, the things that you can do. Dr. Sue said that when something bad happens, you have 3 choices. You either let it define you, you let it destroy you, or you let it strengthen you. And I hope that we're going to decide that together, because we are in it together, that it's going to strengthen us as a community, as a people. And then I cannot emphasize enough how important it is to check on each other. This what kept me going myself for the past 21 days, dealing with my brother's death. And it's very
very-
important to keep check on each other. If you can drop a meal to somebody, drop a meal. And then when you serve others, your mind tends to stay focused on what you're doing, the positive things, and it makes you feel better. So that's another way also to get your mind off everything that's going on around you, by serving other, if you're able to, but still doing social distancing, of course, and then wearing your mask and everything. But if you know somebody needs help and you can drop a meal to them, drop a meal, or whatever you can do to that, to help that person in need, please do so. It will really make that person feel much better, and also make you feel better as well. So like Dr. Cesar and Emma said, we said that we at HANA, we're here for you, and we're in this together, and then we have to stay positive. This too shall pass. We like it to go a little bit faster, but everything is God timing. We cannot control that, but we can do certain things to control our environment. And I hope that everybody, we have so much more. You can go on our website. There's a mental health corner in our HANA website that lists many, many different things that you can do as coping mechanism to really help you go through all that. And then if you're a couple, that will be a different session. I would think, Madam President, we don't have too much time.
We don't have time today.
Trying to recommend the 5
Cameras
love
out.
languages for now. 5 love languages for the couples, if they can
Yes.
get it for now.
That can be another session.
Yes.
Yeah, that will be another session. We need to cover the grieving process also.
Exactly.
Exactly.
Unfortunately, my camera is out. Everybody
Everybody.
black screen, but I'm sure everybody can hear me. This was such an amazing discussion, and to our Facebook family, if you like this session and you would like to see more of it, please go to our HANA Facebook page and go ahead and comment on the video. It will be there for you so we can have an idea of your feeling. Unfortunately, we could not answer any questions today, but we can use those questions to build our next session that we can have. And Ms. Emma is demonstrating how to properly wear your mask. Thank you, Emma. It have to be, of course, very fitted, nice.
Wear your mask, wash your hands.
Exactly, hand washing, still in effect. And there is an order, the recommendation for Miami-Dade County. If you are leaving your home and you're going to be in contact with others, to please wear a mask.
Wear a mask.
Sure, the same order is for other counties, Palm Beach and Broward County, and probably all the way up to the other counties, the other cities of Florida. And I know that is the order also in the other states. So please wear your mask when you're leaving your house, whether it's a homemade mask or a store-bought mask, to wear your mask. We do have a COVID corner on our website. Our website is www.hanaofflorida.org. So you can please visit the website. We have the testing sites listed there. Once you click on the COVID-19, you would see the testing sites, what you need to know about COVID-19, and even community, some community. One of the things also too, we try to post whatever community flyers that is sent to us so that we can share it with the community. So we do encourage you to please visit our website. Once again, is www.hanaofflorida.org. Our telephone number, if you want to reach out by phone, it's 305-609-7498. You can reach us by phone, and we can probably guide you to the website or to or whatever information you need. Once again, ladies, Emma, Marjorie, Dr. Cesar, thank you for this very informative, very empowering, and very uplifting session. I know I felt it, and I'm hoping that our viewers on Facebook also shared it. I do have a little video. I'm going to try to see if I can share that video that was created by our marketing team that is being chaired by Dr. Naomi Merville. It's kind of, awareness to wearing the mask in COVID. And I'm going to share and it's a short video, it's only a minute long, narrated by our advisor, Mr. Jeff Lozama from CMS International, who is one of our advisors and HANA sponsors. So I'm going to try and do that. So bear with me here while I try. I'm going to try and share the video and hopefully you can see it on your end. Please bear with me. There we go. How did you guys like it?
Yes, yes.
We can have
So
a
thank you again to our advisor, Mr. Jeff Lozama, in the marketing team of HANA for creating this beautiful PSA for HANA. So at this time, ladies, we're going to end our viewing session and we thank everyone who have joined. Please leave a comment, please share the live because share the videos, create a watch party, whatever you want to do, because this is a very important information and the video will be there for you to watch later on. So you can see, maybe you missed something and you want to watch it later on. So thank you ladies for joining and thank you to the Facebook family for tuning in and stay tuned. There's more to come and let us know again, what would you like us to talk about during this COVID-19 pandemic that we are going through? Be safe, wash your hands, wear your mask, sanitize, and take care of yourself.
God bless you.
We appreciate you. We are HANA, and together we can defeat COVID-19. Thank you.
Thank you. Thank you. Good night.